All right, so we're going to talk today about key performance indicators, KPIs, and that old adage, how do you eat an elephant? One bite at a time. They're endangered, you're monsters. I think there's a better way than one bite at a time. All right, so we're going to go through KPIs. First, before we go, anybody have any good KPIs that they're working on at your businesses, your facilities? Gino's going to take notes and shamelessly steal them. Anybody want to throw a KPI out? Schedule compliance. Good. That's a great KPI. Yeah.
PM to CM ratio count in hours.
Okay. PM to CM ratio count per hours. I like that one. Gino, thank you. Gino's my chief engineer. Yes, and so the agenda that we're going to hit, we're going to talk about who we are, Stanford Health Care, and give an overview. We're going to talk about KPIs, key performance indicators, our partnerships in creating KPIs. We have several divisions and several departments that work together to create our KPIs, what our systems engineering team and how they utilize the KPIs in their planning of our Maximo system, our PMs, and our job plans. And then we'll have a little bit of time for questions and answers at the end. I am Josh Taylor. I am the Director of Facility Field Services, more commonly known as Engineering and Maintenance for Stanford Health Care. So it's I'm responsible for 7 million square feet at the Stanford campus. So 3 million of that is the hospital that was built roughly from the 50s all the way up through 2019, and also 40 buildings at the School of Medicine. I started my career at the ground level, working at the bottom, turning wrenches, flushing toilets, and plugging in TVs, and then I worked my way through with a HVAC apprenticeship, have a degree in construction project management and one in emergency management and disaster recovery. I spent 20 plus years of my career with Marriott Hotels, buildings just like this one, and then went over to Stanford about a year and a half ago. So that's me and my partner.
Hi everyone, good afternoon. My name is Catalina. I'm the business system analyst on the operational technology team. Our team is under the facilities infrastructure and safety department and security department. I always get that confused because we added one more department into our role. But I do the data quality assurance within our team, and I also work with other teams daily. We are also the system administrators for Maximo. And I've been with Stanford Health Care for 4 years. And then now we're going to go into the SHC overview. Next slide. Thank you. We'll go through the mission, vision, and values. Our mission is to care, to educate, to discover. And our vision is healing humanity through science and compassion, one patient at a time. Our values are innovation, compassion, respect, excellence, discover, integrity, and teamwork. If you're not familiar with CI Care, we are, our patients as how they want to be treated is what we take a look at when we go through like hospitals. We talk about CI Care and use that as an example when we're going to the hospital. And then we'll go on to the next one. So Stanford Health Care is the only level 1 trauma center located in San Francisco and San Jose. We do have a sprawling campus, like Josh said. He oversees 7 million, but we do have just at the main hospital 3 million square feet. And then also we have a team over 18,000 highly skilled and compassionate employees and volunteers. We also have 687 licensed beds. And then I'll turn it over to Josh for the key performance indicators.
So a few things that we're trying to take away from this, our key takeaways, are partnered development of KPIs. So it's important to not just have your KPIs in a silo. So these are my KPIs, and this is what I'm going to do. It's really partnership with KPIs with other teams and how they can interact with you and how they can help you and make yours better. KPI help management with maintenance backlog. So how we use KPIs to catch up, to perform our PMs, how to improve them, and how to move on to the next level. What's the next phase of our journey with our maintenance? And then analysis of this data guides our systems engineering team and to improve the hierarchy, to improve the job plans, to improve what we're actually doing, to make sure that we're doing the right things at the right time and in the right space. So a little bit about my team. At the hospital side. So we have over 22,000 assets that we maintain. That is an average of 41,000 quick responses, 10,000 service requests, 61,000 preventative PMs and inspections, and job plans and regulatory job plans of 1,300 and 206 regulatory. So it's quite a big operation, quite a bit that we've got going on. So we have 77 technicians, field technicians and leaders on our team that service that 3 million square feet, and we've divided it into trades and shops. So electricians, within the electrician shop, they report to an assistant chief engineer of the electrician trade. Same thing with plumber shop, HVAC shop, the finished trades, and then the pneumatic tube and a steam plant that we still have. We also have elevators that we have our separate KPIs for. They report up through our electrician team though. So P-tube, pneumatic tube. So one specialty thing about Stanford and about our hospitals, we have 15 miles of P-tube, and so we also have a team dedicated to that. And I would say that's where we are farthest along on our journey to creating KPIs and to have actionable management of those KPIs to positively impact the P-tube in that system. So here's our execution and workflow in Maximo. This is kind of how we organize our data, how we go from step to step and make sure that we're hitting all our marks. So a work order is generated. It's approved. It goes to the planning stage, to our planner schedulers, and then the work is executed, and then it's closed out. So we average about 113,000 of these quick response service requests, PMs, throughout the year. So with that kind of volume, we need data management, and we need to really focus on what we're doing and when we're doing, just like I mentioned before. So KPIs in each step, so this is how those steps equate to our Maximo dashboards in our Start Center. The work order is generated, and we have a KPI that has planned versus unplanned work. So how many work orders do we have coming through that are outside of our normal operation? And obviously the goal for every facilities team is to have more planned work than unplanned work, right? That way we know we're proactively working, and we're making sure that things are still working before we have a problem and they come down. So the second step is work order approval and work order planning. So you can see we got a lot more red in this area. So these are actual snapshots of our system and of our KPIs. And the planning and scheduling, so that's making sure we're completing PMs on time, make sure we're responding to quick responses within X number of time, making sure that we're hitting all those numbers. And so that's how we kind of manage that KPI. And then work order scheduling. So are we scheduling our PMs? Are we scheduling our work orders on time? So you have your daily rounds, you have your monthly PMs, you have your quarterly filter changes, all those things, and those all can have a KPI attached to it to make sure that you are following through and getting it done on time and for your regulatory compliance. And then obviously at the end we have wrench time. So how long from start to finish is that work order taking? How long does the work actually take? Are we completing it in a correct amount of time? If it gets put in and it's a work request, and then by the time it's completed, what are the number of hours that we've put into that?
Okay, thank you, Josh. I'll go into the partnerships and creating KPIs. I just want to get a show of hand of how many are you in your organization are still trying to figure out what your KPIs are trying to see what's working, what's not. Okay, I see a few hands, great. I think overall, a lot of people are still trying to create new KPIs for their organization. So we'll touch into improvements with our KPIs. So for our team, we want to make sure KPIs are relevant and well understood throughout our departments. We'll get into a couple of slides later on, but we do touch on our facility field services team, and we work closely with them. So we want to set measurable goals, specific and measurable goals to make sure that these are the correct ones that we're going to be using in our organization. And to automate, we're going to be calculating metrics as well to make sure that we don't increase the risk of error. and then monitor, just tracking those KPIs. Either it could be weekly, daily, it could be 2 weeks out, but usually you want to track them maybe weekly just to make sure you're going through the right KPIs for your organization. So here's an example. We work closely with our facility field services team, which is Josh's team. So this is what the START Center looks like right here over to the right. So key performance indicators are crucial within the FFS team, is that we use the acronym as FFS, to provide guidance and track our progress. These are the ones that the team tracks. We use the FFS wrench time, which Josh just touched on, the average age of quick responses, and average age of service requests, and also planning and scheduling. If you are new with Maximo, we do have, like Josh said, planner schedulers who plan out the work for our technicians out in the field. So they meet with our team, with the FFS team daily. Usually it's on a Thursday, and make sure that they catch any roadblocks or provided any support that they need in order to make sure all the KPIs are working correctly. So over to the right, as Josh mentioned, the FFS wrench time, we have a target of 60 and our actual is 82. So we're fairly doing pretty well on that end. And that's the percentage over past 2 weeks. And then an example right here is the average age of service requests, which it shows each of our departments, which we have the systems, which is electric, fire life safety, fitness trades, HVAC, and so on. And that just gives you the target and the actual that they're at in the KPI.
All right, so what do you think the most important thing is to have a quality KPI? It's their computer, not mine, so apologies. To have a quality KPI, what do you think you need?
Good data.
That was the exact thought that I had. That was perfect. Yeah, good data. If you don't have good data, then you can't create a quality KPI. Plain and simple. So and then the follow-up behind that is you need an action plan to drive a result, right? So key performance indicators are monitored by each assistant chief engineer. So they all have their own START Center within Maximo where they can go to and say, okay, I'm the plumbing ace. I click on my plumbing shop, and then I can view how did I do last month? Were my PMs on time? Were my quick responses within X number of hours? Like, how did I do? And they can look at that and monitor that. And then, as Lynn mentioned, or I'm sorry, as Catalina mentioned, Lynn's the other partner that we have. As Catalina mentioned, they give us this data, but what's the problem with being given data? So, as I mentioned, and in a previous session that some of our colleagues gave, our P-tube system is far along that, and we've taken that data and we've turned it into something actionable. So a lot of the stuff that we have coming through Maximo right now it's actionable, we just don't know what to do with that data in some of our shops. So I've actually, over the last several months, I've been developing a position that is gonna work with the occupational technology team. It's an administrative operations analyst. So somebody to take this data that they're giving us and say, hey, let's focus now on what we can do. So a good example, a simplified example is you have a toilet and every 2 days that toilet is clogged. It's the same toilet over and over in the same hotel room, the same patient room, the same office building, it's the same toilet. And that's data that we can get from Maximo, right? And you can look up, you can say, okay, what are my top 5 complaints? Oh, it turns out it's this toilet. So now what you gotta do is turn that into something actionable, right? So somebody to sit down with these assistant chief engineers and take the data that they're provided by Catalina and say, okay, let's make a plan around this. And so we start off with, well, what's the simplest thing? Let's replace the toilet, right? Pull out the toilet, put in a new one, and let's monitor our data again. So we go back to Catalina's team, and we say, hey, can you show us now the data from that toilet over the last month? Well, guess what? That toilet is now flushing. We're not getting any complaints on it. We're not going back every week And so now we know we can cross that thing off, it's done. And that's where we're at with the P-tube cycle. And we use our pneumatic tube, and we've created cycle counts where we monitor a station, we monitor a piece of equipment, and show that a carrier has gone through that station 1,000 times in the last 2 days. But then we have another station, and this is pretty accurate, we have another station that nothing's gone through there in a month. That happens. So where should we be focusing our time? Are we doing reliability-centered maintenance and focusing on the one with 1,000? Or are we doing preventative maintenance, and we're doing monthly, we're going to the one that's 1,000, and monthly we're going to the one that hasn't seen any transaction this month? And so that's where this data and really focusing on that, and our partners at Occupational Technology have done a great job. Operational, I keep saying occupational.
It's operational.
I know, operational technology. I want them to be like occupational, when you hurt yourself. I want them to be that team. Operational technology have done a great job in giving us this data and creating job plans with our partners in systems engineering to really focus this data and give us something that we can work on. All right, this is one of my favorite slides, and I'll tell you why in a minute. So it's all green, right? All green. And the reason it's all green is because we cheated. We didn't change the data, but we cheated in our KPI. So I'll go over it in a minute. So actionable key performance indicators, tracking insights, turning data into practical strategies to enhance performance and goal achievement within Stanford Health Care. So that's our goal, right? That's what we did. So this slide is focusing on the bottom here, failure codes. So failure codes, we all know what failure codes is, right? That's what happened. This is the reason this piece of equipment failed, and this is the repair that I had to do on it. Well, the KPI was have a certain percentage of our quick responses and our service requests have a failure code put into it. And it wasn't great. Technicians weren't putting it in because that's on their time, their level. They've completed the work, and they're like, oh, this happens all the time on this piece of equipment. I know what's going to happen. I'm going to go there again next week. I'm going to push the same reset button that I had to push today. I had to push last week and the week before that. And so I skip that field and go on to the next one. So what did we do? What do you think we did? We made it a required field. We went beyond an SOP, and it's a required field. They cannot close out the work order unless they fill out that failure code. So now we have better data again that we can then go to the operational technology team and say, hey, tell us what the failure of this piece of equipment. We are going to that same toilet. Now we can look at that toilet, right, and say, what is happening? And there's a failure code in it. Oh, the toilet won't flush, it gets clogged. Or the pump, the pump is not working anymore, and they had to go hit the breaker, hit the reset button, whatever it is. And so now we can use that data to create future KPIs and to create job plans and to create capital plans based on that result, on that work that's now coming out of that. So that's why it's my favorite, because it's a guarantee now, KPI, because they have to do it, so they don't have a choice. So, all right. All right, continuous improvements for FFS. So this slide, not as great, right? There's lots of red in there. There's still a lot we can do. The big three that we have right now are MRO, implementation to manage our waiting on parts. So waiting on materials is our biggest challenge, and that's typical probably with just about everybody, right? We're always saying, oh, we got a part. How many work orders do you have out there? And you have your whiteboard up there, and it says waiting on parts, waiting on parts, waiting on parts. How many of those you got? Everybody's got those. But we know that that's our biggest opportunity to succeed, and so we can now shift our focus and say that MRO implementation is our next step, our next phase of Maximo at our property. Average days of planning, average number of days that a work order is open, that a PM is open. So that's with our planning and scheduling team, and implementing a Maximo scheduler and making sure that we're really focusing on having those PMs come out on time, and they're planned and they're executed by X date, right? And that's another problem that we all have. We all have, the leak happens in the COO's office, and so now everything gets thrown out the window for the day. Oh, it turns out it's a 3-day job, and how many PMs did I not do now because I was focusing on this? Right? Everybody, we all experience that same thing. And then average number of days to execution, that's the second part of that, because it wasn't planned, because we had that leak in the COO's office. Now it took us 9 days to complete this PM or to complete this work order because we are behind on these other things. So we can really drill down and talk about and focus on what we need to do next, and work with the operational technology team to manage that. All right. And I would like to introduce now our systems engineering team. There's nobody here, no need to applaud them. Systems engineering team and how they utilize KPIs in planning and design. So the systems engineers are a group that work with our operational technology team, with our facility field services team, and they have specialties. So an electrician, not just an electrician, but what's the word I'm looking for now? You don't know. So a licensed electrician and an electrical engineer, there it is, an electrical engineer and a mechanical engineer, and somebody that really, they can understand the full mechanics of a system works. As an HVAC guy myself from years back, I know a lot, and I can do a lot, and I can diagnose a problem super quick once I'm on the system, but I don't always have time. Right? My technicians, they don't have time to sit and write up reports and say, this is why this has failed, this is why this has failed. And so our systems engineering team has taken that role and that responsibility to provide us support. And we work with them every single day. Every single day we're on the phone with them saying, hey, we need you to investigate this piece of equipment, this system, whether it's an air handler unit or whether it's a breaker or a transformer, whatever it is, they're digging into whatever we request for them to do so that we can then improve as well. So this is kind of their life cycle and how they operate. They identify a need. So I'll give you a basic example. We had a leak that occurred in a cath lab. A cath lab is a type of operating room. Doesn't sound great, right? Like, I mean, if you're a doctor in there, heaven forbid you're a patient in there, and there's a leak, right? That's not great. A leak in a cath lab that came down, and my team responded, and we found out it was coming from an air handler unit, that the condensate pan was overflowing. And then it just so happened to be overflowing from the roof 3 floors down. Its exit point happened to be the cath lab. So we identified that need, right? And so now we got to make a plan. Well, the first thing we got to do is find out what the need is and what the plan is around that repair. And so then our systems engineering team really plans around it. What are we going to do? How are we going to fix it? And then they make a design and a proposal, and with that design comes cost analysis, various options. They'll give us 3 or 4 options on this option will cost this much, this option this much, this option this much, and then they'll pass it on typically to me, and then I make the decision, okay, how do I want to go about this? How do I want to pay for it? What do I want to do? Procure and build, so then they work on field review and construction tours, trying to again expand our knowledge on the facilities level and have that partnership with our project management team and also with our planning, design, and construction team. So that way we have more input into how the facility is going to operate, right? What's everybody's biggest, any architects in the room or design engineers? Great. Our biggest complaints as operators are architects and design engineers, right? That's always the challenge, is we're always saying, oh man, this architect, oh man, this engineer. So then they work through commissioning that project or commissioning that piece of equipment, operating and maintaining and monitoring performance. So how is that air handler that leaked, how is it performing after the repair was done? And then modifying or upgrading as needed of that equipment, and engineering reviews, cost analysis around that, and then decommissioning and getting rid of it because that piece of equipment is no good. So it turns out that we were able to diagnose that air handler really quick. It's in an old building that's scheduled for demolition and redesign in the next 2 years. The air handler settled. And it settled away from the condensate drain. So it was really quick, it was really simple. We just popped a cap in the other side of it, wrapped it around and wrapped it all the way around and put it straight into the condensate drain on the other side, and now we're golden, we're back up and running. And that was a fairly simple one. However, our systems engineering team was able to write us a paper saying, hey, this is what we've done already, and this is the recommended path. You can replace that air handler unit, and you can do a full redesign. You can do these other things, but these are the pros and cons for each of those.
A quick question in regards of failure codes. So that's on the side of reactive maintenance. On the preventive side, do you have what we call, on our side, we call it findings. So when you do a preventive maintenance, you find something and then track that, so because you have some cost avoidance there before it happens.
Yes, there is. So as you're going through a PM, if something fails in the PM, something's not right in the PM, you can create a work order based on those findings. So yes.
Yeah.
Good? Yes, sir.
So in regards to your example with the air handler, is this a result of PMs not being followed, or did it result into a PM eventually?
Well, I mean, it wasn't really anybody's. The building literally just settled crookedly. And so there wasn't really a missed PM per se. I mean, the PM had been done. The pan had the tablet. Everything. I mean, so everything looked like it had been being done. This was just a result of unfortunate case, pretty much. So, but we do have a lot of use cases just like that, where something happens, we're reviewing it, and then we send this team through, and they will do a drill down in it, and then it results in a change of a job plan on a piece of equipment, or the addition of a job plan on a piece of equipment, things like that. So yeah. All right. And quickly into, this is the systems engineering swim lanes and their scope of work. So they're focused on regulatory compliance initiatives. So we have OSHA, we have OSHPOD, we have the Joint Commission, and they're focused on ensuring that PMs meet those regulatory compliance and that the regularly reviewing assets and job plans. So they're really focused on that. That's a big part of their scope. The facility condition assessments. So taking a system and saying, okay, this is our plumbing system, let's do a condition assessment of the whole plumbing system, and then leveraging Maximo asset failure data based on that condition assessment. Day-to-day support to FFS, as I mentioned, they're with us all the time, and review of facility field services KPIs. So they go through and they say, okay, let's look at these KPIs, let's look at how the elevators are performing, let's look at how the P-tube is performing, and see where we need to put our focus. Reliability engineering, so this is RCM, or reliability-centered maintenance, and then that root cause analysis that I also mentioned, leveraging Maximo asset system data, Maximo data quality. So that's always a problem that everybody has, is making sure that your data in the system and coming out of the system is right, and so they're responsible for ensuring that data is correct with our operational technology team, and then regularly validating asset hierarchy. So making sure that the job plans and the frequency is all correct, that this is something that needs to be done monthly, or can it be done every 6 months, because again, we're back to that P-tube with a cycle count of 0 in a month and a cycle count of 1,000 in a week. So, all right.
Okay, now I'll get into the system engineering process with KPIs. In the last slide, Josh talked about the Maximo data quality, so that would be our team putting in the data into Maximo. But for our system engineering team, they focus on the RCM study on critical systems, improving job plans, and also the PMs that we use in job plans as well. So what system engineering usually take a look at is system availability and reliability, and also reducing the maintenance costs as well. They also want to improve patients' experience by reducing downtime as well. Operational technology, facility field services, and the system engineering team work together to improve on all these KPIs that they work on. So we're very working together, meetings here and there, and trying to improve on our KPIs. We also want to, go back. I wanted to touch on, they do look at the number of corrective maintenance work orders. And then the next slide that we will be talking about is the mean time between failure, and we're using elevators as an example, so I'll touch into that point as well, and mean time to repair. So yes, our use case is elevator KPIs. We do have a month-to-month review, which Josh's team, I think they do this review. So you'll see these graphs right here. I wanted to use this as an example because in healthcare, in hospitals, elevators is a critical system that we use, and patients are going to unit. We have to make sure our elevators are up and running. So we use this as an example. We use the average mean time to repair. We've increased by 77.5%. You'll see that over to the left. This example is from, I believe it's from March, so it's a couple months back. And then we have the mean time between failure, so that's the MTBF, which you'll hear a lot, improved by 0.8%, and the number of unplanned work orders, which is improved by 38.9%. And then the uptime and availability improved by 2.8%.
And I wanted to update these slides at the last minute because the last 3 months we've just been running bangers. It's been great. We've had really low downtime with elevators in general, and we've had a lot of success over the last year. Again, implementing these KPIs and implementing these action plans, working with our elevator partner, our elevator contractor, and saying, hey, these are the machines you need to work on. So it's really helped with that.
But yeah, I wanted to use that example just because it is very important for our families, our patients, and visitors also that are just visiting the hospital. We wanted to use that as an example because it is a critical system at our healthcare facility. Now we'll get into benefits and challenges. So our benefits, we want to drive decision making. We want to make sure our KPIs are what we're going to be using in the field. The reason, we're not just going to have KPIs and just not be using them. It wouldn't make sense. So we want to make sure we drive the decision making. We want to target key areas of improvement as well. So keep tracking them every single day, like our team tracks them every single day and works to improve in how we're going to be using them in the future. And also growth and competitiveness. We want to make sure we're using the right KPIs. That way the technicians know what they're doing in the field. And then also the asset tracking, maintenance scheduling, and procurement processes, which save time and reduces errors. The challenges that we do face are choosing the right KPIs. How do we know what KPIs we're going to be using? And then also the reliance and importance of what the technicians are using in the field. And also automating those KPIs to reduce the potential errors in the field.
All right. So we have a few minutes for questions. If anybody's got something pressing, yes, sir. Hi, I'm Josh.
Oh, there's yeah.
Aaron, nice to meet you.
Aaron, yeah. So what's your entire asset management team look like? It seems like you have a lot of people working in a lot of various aspects of it.
So I mentioned that I worked for Marriott Hotels, and when I worked for Marriott, I was director of engineering. I was operational technology. I was project management office. I was all these other things. We have a lot of resources, a lot of great resources, but it's because our system is so big, our building is so big, our footprint is so big, and so yes, we have, working in the operational technology, focusing on Maximo, I would say, and this is average because some people don't always just do that, I would say we have probably 6 people that are actively using Maximo on a daily basis, and they're making changes.
Does that include your planners as well?
Yes, that includes planner schedulers. We have 2 planners and schedulers, and they're assigned to the shops. So that way the technicians can know exactly who to go to, and the assistant chiefs know exactly which planner scheduler to go to.
Yeah. Our team has grown a lot. We started with only, at the time, we started with just 2 business system analysts, and then we brought on our partner, Lynn. She's our business reporting analyst. So we've grown since I've started here.
Hey, Josh.
Hi.
To capture some of the data, like uptime, downtime, non-productive time for wrench time, do you leverage mobility in the field for the techs to enter that, or is that done by your production team?
So we rolled out Maximo Mobile a year ago, and we are still onboarding that. So we're still in the process of getting everybody's buy-in. I mean, we all know that that's one of the biggest challenges that we face with our teams is buy-in on a new process, a new opportunity, some way to make us better and more efficient. So in Maximo Mobile, they can input hours worked on a specific job. Also, if they click start in Maximo Mobile and click stop in Maximo Mobile, it'll track their time and then put it in. And then as a KPI, we can then use that for FTE planning, for planning on how many staff we need in each department. About 2 or 3 months ago, my HVAC ace came to me and he said, "I don't have enough people. I don't have enough people. I don't have enough people." So we pulled up the wrench time report for his team, and we're talking like 10 hours, 11 hours in a 40-hour work week. Productive, yeah, that they're putting wrench time to, but that's not accurate. I don't believe that at all. I 100% am confident that his team is working more hours than that, but they're just not putting in the system. And so I came back to him and I said, I can't go to bat for you until this is correct. Right? I mean, because I have no leverage. I have nothing. I have no. My KPI says you have plenty of time with the team you have. So I am leveraging that for conversations with my team as well. Yeah. Mm-hmm. Yes, sir.
You prefer your work orders as quick response work orders, but what about like the medium and low priority stuff that comes in all the time?
So we can prioritize and we remove things. So we have service requests that are not the quick response. So if you have the quick response is the leak in the OR. The service request is the clogged toilet, depending on where it's at. Okay. You know, if it's a clogged toilet in a employee restroom, there's 7 more in that restroom. We'll get to that in a couple of hours. So we do delineate between the types of responses as well.
Okay.
And I think that's and correct me if I'm wrong. I think we created those codes, right? The QR quick response and the SV.
Mm-hmm. SRs.
Yeah, that's what I said. SR. What'd you say?
You said it.
So we created those and put them into Maximo to meet our needs. Yep. Back here. Oh, he back here first.
Oh.
You do because so they can hear you on the recording.
Yeah.
You do have a big voice, so do I.
So in the beginning, you talked about the measurable part. Mm-hmm. What team or how did you come up with that number? And where does that slide, or does that ever change over months?
As far as what our KPI is? So we want to hit X percentage. So and I'm going to go back to my Marriott days. This is all very, very ingrained in Marriott culture and hotel culture in general. Is you look at your previous year and you say, okay, we hit 75% PM completion in 2023. So 2024, our PM completion needs to be a goal of plus 2%. So instead of 72, we need to hit 74, and then we need to have a stretch goal of 2% above that. That's how I wasn't around when we created the KPIs here. But I imagine there was a similar discussion at that time, and I will be, as my tenure extends, those kinds of conversations will definitely be had, and we will push the needle on a lot of those things. Don't tell Gino.
I think there was one over here.
Right here.
Hi, Josh. My name's Mike. I work for Central Arizona Project, and one of the challenges that I've faced is, again, getting good data. Sometimes labor hours, booked labor hours, and things of that nature get billed to different work orders when they shouldn't be. In relation to that, or in regards to that, what sort of solutions did you find through your journey?
Get a Lynn, get a Catalina. Historically, that's as I mentioned, that's what I did a lot in previous positions. But the campus is so big and there's so many people on the team that I don't have time to dig in that granularly. And so honestly, that's one of the reasons I've created this role, this administrative operations analyst, is to help me specifically with those things, to help me analyze this data. I can do it. I mean, I have the experience. I just don't have the time. I don't have I don't have it in me anymore to look at numbers and data. So I mean, that's one direction that I'm currently taking. In my previous life, we had a system similar to Maximo that spit out the same kind of data, and it came automatically into dashboards for us that we can kind of analyze that as well. So we utilize a system called Domo as well that interfaces with Maximo, and I shouldn't be throwing any plugs for anything out there, but we're going to plug Domo, I guess, that we use, and what it does is, I'm going to go back to the P-tube example. You should have been in the last session. You would have loved it. The P-tube spits out a spreadsheet with thousands of lines of code on an Excel spreadsheet, and we can take that and we can now send that through some filters and put it into a dashboard that now just spits out our most important things. And so that's Maximo can really integrate with things like that pretty well. And so that's something that we're doing at Stanford actively. One more question? All right, I recently learned and recently heard we shouldn't end on a question and answer. So I'm going to kick it back and ask you the same question I asked at the beginning and see if anybody has any new insights. How do you eat an elephant? First off, don't eat an elephant. How do you eat an elephant? Not one bite at a time, with a team. Right? That's better. That's kind of my takeaway from this is I can't eat an elephant by myself, but the team that we've built around us at Stanford and the team we've built to help us manage Maximo and our KPIs is really helping us to eat that endangered species. All right. Have a great day.
Yeah.
Thanks for coming.
Thank you.